has been experiencing research, the academic area, and also the pharmaceutical industry. We will introduce the background of Professor Havazelet. The event of today is organized by the pharmacy department at the School of Chemistry, and thank you very much.
Good afternoon, everybody. I will tell you briefly the background of Dr. Havazelet Bianco-Peled. Dr. Havazelet, she's a full-time professor at the Department of Chemical Engineering at the Technion-Instituto Tecnológico Technology in Haifa, Israel. Professor Havazelet is an expert in biomedical polymers, hydrogels, and biodation. She has received several awards for her professional accomplishments. She has written about 100 research publications, edited a book, and has more than 10 patent applications, either granted or pending. Professor Bianco is the founder and former CSO of Cialantis Limited, a company that develops, manufactures, and commercializes novel biomimetic tissue adhesives based on a technology created in her lab. Her current research interests include polysaccharide-based hydrogels, 3D bioprinting, mucoadhesive, drug delivery, physical characterization of biological, biomedical, and biomimetic nanosystem. Welcome, Professor.
Thank you very much for the nice introduction. And first of all, thank you for having me here. It's a wonderful city, and we are enjoying very much, and it's a wonderful university. I'm going to try without the microphone. Can you hear me in the back, or do I need it? You hear me? Okay, so with your permission, if you don't hear me, please raise your hand, because no? You don't hear me. Okay, microphone it is. Okay, so good noon, everybody. And thank you for the introduction. I'm from Israel. My name is Havazelet. I'm from the Department of Chemical Engineering. I'm sure that many of you have heard that Israel is maybe you have heard the name, and those who have heard the name of Israel may have heard that this is a very small country. So I just wanted to start by showing you how small it is. So this is a map of Europe, which is about the size of Mexico, I believe. And this is Israel, the small, very tiny triangle in the middle. So it is a very small country. 10 million people live there, about half of the people who live in Mexico City. But still, we have many universities, and I'm proud to be one of the faculty members in one of them. And this is the city where the university is, Haifa, in the north of the country. These are just some nice pictures from Haifa. It's near the beach. And finally, my university is a Technion founded more than 100 years ago. So it's an old one, and I'm from the Department of Chemical Engineering. And as the title says, I'm going to talk today about mucoadhesion. But I have kind of a sticky experience. So I started with bioadhesion many years ago. And in general, bioadhesion is defined as adhesion or contact of two surfaces, joining them together for extended periods of time. And if you're talking about bioadhesion, at least one surface has to be biological in nature. So my own experience started with cell adhesion during my postdoc, and then I studied biological adhesives, mainly those coming from algae. And then we moved to tissue adhesives, as the kind introduction said. A technology from my lab was evolved into an industrial product of tissue adhesive used in internal surgery. But today I would like to talk about mucoadhesion. And what is mucoadhesion? First of all, we all know that we can deliver drug into the body in many ways. We can swallow the pill, we can inject the drugs, we can use patches, and all sorts of things. But not many people are aware to a different and very interesting, I think, route of drug delivery, which is a transmucosal drug delivery. So transmucosal drug delivery uses the mucosal layer to transport drug into the body. The mucosal layer is this gel-like wet surface covering organs in our body which are exposed to the outer environment but are not covered with skin. So these include the inner cavity of the mouth, the GI tract, the eyes, and so on. So all the surfaces that are not covered with skin are covered with mucosa surface. And the mucosa surface itself, you can see here the cells, and the mucosa surface itself is secreted by the cells, by the epithelial cells. And if you're a chemist or a polymer scientist, you would say that it is a hydrogel, a natural hydrogel that, like any hydrogel, contains mostly water, 95% of water. And the other components are all sorts of things. And the most important one for our purposes are glycoproteins called mucins. These molecules are giving the mucin its gel-like appearance because they have a protein backbone here, which is rich in cysteine, and the cysteine create SS bonds, which form a hydrogel. So this is a natural hydrogel, and its purpose is to prevent pathogen from going into the body and prevent water and humidity going out of the body. So this is a natural protective layer. And if we want to use this route to deliver drugs to the body, we need to overcome this protective property of the layer. And we have some other challenges that I will discuss in a minute. Why we want to do this? Because transmucosal drug delivery has many advantages. First of all, it is not invasive. So it's not written here as the first point, but still, it is non-invasive. It is not painful, and you don't have to inject anything. It bypasses the GI tract. Many drugs are sensitive to the acidic conditions in the GI tract, so this is another good thing. Also, there are many blood vessels beneath the mucosa layer, so the absorption is very fast and very efficient. Also, we bypass the hepatic elimination of drug, and also because the drugs go directly into the bloodstream, the onset of action is relatively fast. So there are many good things about transmucosal drug delivery, but there is a challenge. In order to overcome the barrier properties of the mucosa, we need some kind of a vehicle that will remain on the mucosa for a long period of time to allow sufficient time for diffusion. And in order to do that, we want to stick something on the mucosa layer, and this is the mucoadhesion drug delivery vehicle. And the challenge here is how to stick to wet and slippery and very irregular surface. Usually it's very hard to stick things into or onto wet surfaces. Think about this for a minute. If you go to a shop and you buy a glue, what does it say in the instruction for use? Dry the surfaces well before adhering, right? So if you want to stick something to wet surfaces, this is a big challenge. So what we want to do is to stick drug delivery vehicles on the mucosal surface, and as I said, chemically they contain glycoprotein. So it's a protein backbone with sugar side chains, which are negatively charged. And then what we want to do is to take a polymeric vehicle, which will form a contact with the mucosal layer, and then in a second step will interpenetrate into this hydrogel and create strong bonds that will help to stick the vehicle or the polymer to the mucosa for extended period of time. Sometime around 980, so not too long ago, the concept of mucoadhesive polymers came into the world. And the polymers, the mucoadhesive polymers, are simply polymers that interact with the mucosa layer, either by physical interactions or chemical interactions, to allow extended retention time on the mucosa layer. So the interactions can be non-covalent bonds, such as hydrogel bonds, van der Waals forces, electrostatic interactions, or even simple entanglements of polymer chains into the hydrogels. Can be covalent bonds, such as disulfide bonds. I will show that in a minute. And can be biological interactions, such as specific binding molecules. The first type of mucoadhesive polymers, these are called the first generation polymers, are simply hydrophilic polymers that are capable of forming non-covalent bonds with the mucosal layer. These are mainly hydrophilic molecules, many polysaccharides such as alginate or chitosan, that form, or even cellulose derivative, that form non-covalent hydrogen bond or entanglement with the mucosa. They are mainly used as solid dosage forms, such as tablets or films, and their adhesion capabilities are nice, but not excellent. And these are used commercially. Now, many commercial products are based on these polymers, but the adhesion capabilities are still limited. And therefore, the second generation polymers came into the world, and these are divided into two large groups. First, those polymers using specific binding molecules, such as lectine, for example, that have specific adhesion to sugars, so they can target the sugars and stick to them. And the other group is called thiomers. The thiomers are simply hydrophilic polymers that were modified to contain a cysteine group, and therefore they can create disulfide bonds with the glycoprotein on the mucin. Those were invented by Andreas Berenkopf in Innsbruck, and there are many thiomers that are called thiomers, okay, or thiolated polymers. And I know that the text here is too small to read comfortably. I'm just showing this slide to show you how many polymers have been modified by this approach. And if you Google it or you use Google Scholar, you find thousands and thousands of articles using this approach. So when we wanted to see, or when we wanted to explore, decided to explore for the first time mucoadhesive polymers, and this work was done by my former student and now a professor herself, Maya Davidovich-Pinchas, we said, okay, we want to see how this thiomer works. And we started with what we thought is a very simple model of cell encapsulation. So we tried to encapsulate fish eggs, okay, just as a model. And what we used alginate, it's a very well-known polysaccharide. I'm sure many of you have worked with it or at least heard about it. The nice thing about alginate, you said it is cheap, but not only cheap, it can be very easily cross-linked with calcium ion, which is a cold gelation, non-toxic, very simple to perform, and this is why we wanted to start with it. And what we did is to create the thiolated alginate, or the thiomer, from the alginate. So this is the chemistry, simple chemistry. We are chemical engineers, not chemists, so we use only simple schemes. So you conjugate cysteine to alginate, and you get the alginate thiol, and we did some NMR and FTIR just to verify the product. And when we did adhesion assays, I forgot to mention, I will mention it now. We are using mucoadhesive polymers as drug delivery vehicles. And in all our studies, we perform these drug delivery assays, but I'm not going to emphasize this part too much, because in mucoadhesion, I think that the most important part is adhesion itself. So some adhesion assays are very simple, and some are more, maybe require more thinking and adaptation, and therefore I will emphasize more in my talk the adhesion assays. So this is the simplest adhesion assay. What Maya did is to perform a simple tensile test. I will put this for a minute. You take a tablet, you take a tablet of the mucoadhesive polymer. You have a surface made of intestine of a pig, for example, or any other mucosal layer, and then you put your tablet on it. So this is a very simple test. It's done in a tensile machine, the same way, if you know, the same way you test mechanical properties. And what you see here is the adherence strength. So this is the force required to separate the tablet from the surface. And the most, let me say, striking finding of this study was that the thiomeres that were shown in thousands of studies before to have better adhesion properties compared to the non-modified polymer, this was not the case in our studies. We obtained exactly the same adherence, and we were puzzled by this. And the bottom line of our studies was that the thiomeres cannot create the disulfide bonds with the mucosal layer if the environment is wet. And this is because, and this is shown here, because the thiomeres themselves create a hydrogel. So you can see here the thiomere, the G prime is larger than G double prime in the thiolated alginate, meaning that they are a gel before you put them on the surface, and they cannot interpenetrate. And most studies use dry tablets, so they could not see that. So this is a problem. This is a limitation of the thiomeres. And therefore, we were thinking, what can we do to prevent this phenomena? And what can we do to create mucoadhesion polymer that will function, that will work well, even in wet environment? And this led us to the concept of covalently associating polymers. What we wanted to do is to create a polymer, or a family of polymers, that will adhere to the environment by creating a covalent, non-reversible covalent bond, but it has to be a reaction that can take place in physiological conditions without any harmful or toxic reagents. And our idea was to use polymers that have a reactive group. And the first polymers, the first group of polymers that we worked were polymers carrying acrylate end group, and later on malamide group. These are capable of forming Michael type addition reaction with the cysteine, with the thiol groups on the mucosa. And by that, we were thinking that we will have a better adhesion and extended period of, or extended residence time of the adhesive molecule on the mucosa. So this was the hypothesis. I will only show several examples. I will try to keep the time. In our lab, we studied over the years a range of polymers. We started with polyethylene glycol, and then all acrylated, and then alginate and chitosan, and a block of polymers called pluronic, and then we did some, we studied some malamide, modified polymers, and then we looked into different dosage forms ranging from tablets to paste to micelles to nanoparticles. We also have several studies on model surfaces for mucoadhesion studies. I will not show any of those today because the time is too short. Okay, so just as a proof of concept, we were looking for the simplest polymer we can find, and the simplest polymer we could think of was polyethylene glycol diacrylate. So this is polyethylene glycol, a very well-known biocompatible hydrophilic polymer, which is, if it has if it's long enough, it has mucoadhesive properties by itself, but we used a short one, and it has two acrylate groups. And this is what we wanted to do first, to see if this is a mucoadhesive polymer. So first, as I said, the mucoadhesive studies by themselves can be challenging. So first we used NMR, which is it's not conventional, it's not a conventional adhesion assay. But if you mix the polyethylene glycol diacrylate with mucin, with the glycoprotein, you see that the signal related to the acrylate groups diminishes. So this is indication that the chemical reaction did occur. Does this lead to adhesion? So in order to do that, we perform two types of tests. First, this is called the Hassan method. I don't know if you heard about this, but the Hassan method claims that if you have a mixture of a mucoadhesive polymer and mucin, and you mix them together, you see that the viscosity of the mixture is larger than the viscosity of than the sum of the viscosities of the individual components. So here you can see the viscosity of the PEG, the polyethylene glycol, which is very low, the viscosity of the mucin with the PEG, and the viscosity of the mixture with the PEG diacrylate, okay? So you can see that the viscosity of the mixture is higher than those of the individual components. And in this case, it was nice to see, because usually when you mix two polymers, the viscosity is higher, so there is no surprise. But if you compare this to a mixture of polyethylene glycol without diacrylate groups, you see that the viscosity is still higher. So this is a first indication, not direct indication for mucoadhesive. And also, we wanted to provide some direct indications. So here we again repeated the direct adhesion assay. So we created a tablet on the surface and pulled, and you can see that the diacrylate and the thiolated alginate have about the same adhesion. So this was, well, this was a nice start, but adhesion is still, it's the same as the alginate, but not better. So the next step was to go to higher molecular weight polymers, because higher molecular weight polymers are supposed to have better adhesion. So, I forgot about this slide, I apologize. As I said, my focus will be on adhesion assays, but still, these are drug delivery assays with all the required, mathematical calculation, extracting the diffusion coefficient and showing that indeed we can delay or control the release of drug diffusing out of these hydrogels. Okay, and now to the longer polymers. So our friend the alginate, we had the thiolated alginate. Now, why not create a covalently associating polymer, acrylated alginate? So this was done in two steps. First, we take the alginate and create the thiolated alginate. This is alginate thiol. And then we add excess of polyethylene glycol diacrylate. So one acrylate group of the PEG-DA attaches to the thiol group. This is, again, a Michael type addition reaction. And the other acrylate is free to react with the mucin. And this is, these are the adhesion assays, direct adhesion assays. You can see here the native alginate. These are two types of alginate with different molecular weight and different physical properties. So this is the alginate. This is the thiolated alginate, slightly better. And this is the acrylated alginate, much better. And with a different alginate, again, the native alginate, the thiolated one, and the acrylated one. So here we said, okay, we have a good thing. We had to confirm that these molecules are not are not toxic. So these are cell assays confirming that. But this was nice. And again, the drug release assays demonstrating that we can sustain the release of a small drug, ibuprofen in this case, from the alginate. Okay. Now, alginate is a mucoadhesive polymer, I already said. I also mentioned that the mucin is negatively charged. So if we choose a positively charged polymer, we are supposed to have a better adhesion. So why not use that? And on top of that, create an acrylated version of this positively charged polymer. And our natural candidate was chitosan, a semi-synthetic polysaccharide, which is, well, in acidic conditions at least, has a positively charged, has a positive charge, and it is known as a very good mucoadhesive polymer. This is Yulia Shitrit, my former PhD student who performed this study. And she, in addition to studying a different polymer, she also wanted to know how important is the length of this peg that we attach to the main chain of the chitosan. So she used two versions. One is very short. This is 700 Daltons, peg with 700 Daltons. And the other was quite long, 10 kilodaltons, okay? And now she performed the synthesis, and these are NMR studies, and from NMR you can calculate the degree of acrylation. That is how many amine group on the backbone of the chitosan are replaced with peg chains, okay? So after she did the synthesis, she found that with the longer chain, she obtained only 30% of acrylation, and with the short peg, she had 98% of acrylation. So we thought, okay, this is not a very clean experiment, but maybe we can go ahead and do some adhesion assays, and which one would you expect to have better adhesion? This one, This one, obviously, right? Because it has more acrylates, right? So we had to measure the adhesion, and now we went to a different adhesion assay. I'm just trying to share with you some of the experiments we did over the year. This is called the rotating cylinder. I like this assay. It's cool. It's very easy to perform. This is a homemade apparatus. It's a cylinder made from kids' toy. They have these noodles that are in the swimming pool. So you buy one of those, and then you cut it into small pieces. And then this is a piece of intestine. This is not something that kids can play with, but still you can glue it on the noodle. And these are tablets of the mucoadhesive polymer. You simply put them on the tablet, and then you put the cylinder in a beaker, 37 degrees with PVS or something that simulates body fluids, and you rotate the cylinder. And the student sits there and watches and looks for the time that the tablets detaches from the cylinder. So this can be very elaborating, but still, this is what she did. And she found that the chitosan detached after about 1 hour. And she saw that the thiolated chitosan detached after 6 hours. She had to stop the experiment, because you know what happens to tissues after 6 hours in body fluids at 37 degrees, so she had to stop the experiment. She also saw that the acrylated chitosan has better adhesion, so it's a good adhesion. After 6 hours, it was still there. But the one with a short peg detached almost immediately. So not only it was not better than the non-modified chitosan, it was much worse. So it has no adhesion at all. Here you can see the tablets after the experiment. So it looks like the pegylated chitosan has better adhesion than the thiolated one, but still she did some adhesion assays, and she saw this is how it looks. Really very, very good adhesion. It pulls the mucosa layer from the surface. You can see this is a chitosan. This is a chitosan with the thiolated chitosan, and this is the acrylated chitosan, much better than the thiolated version. And this version is with the long peg, and the one with the short peg had much worse adhesion. So the question is it the length or the degree of acrylation? Because we thought maybe too many acrylates are not good too. So she prepared a different version with only 45% of acrylations, and you can see that the adhesion is still not good. So the bottom line was that so this method is good, it produces good mucoadhesive polymers, but we need both enough acrylate groups and long chains to allow penetration into the surface. One other thing that she has done is to perform some rheology studies. So this is again the Hassan method, where you try to show that the viscosity in a mixture of polymer and mucoadhesive polymer and mucin is larger than in a pure the viscosity of a mixture of a mucoadhesive polymer and the mucin is larger than the viscosity of the polymer itself. And here you can see a demonstration that this rule is indeed good. You can see with a short peg, the viscosity of the mixture is the same as the polymer itself, but with a large peg, the viscosity is higher, and also at large shear rates, you still have very high viscosity, meaning that even if you shear it very fast, the conjugation is not broken. So this is a stable covalent bond, non-reversible covalent bond, and therefore the viscosity is higher even at high shear rates. Okay. Now, I have other stories about high molecular weight polymers, but I would now want to devote some time to nanometric vehicles. Many of you are interested in nanoparticles, so we are also interested in nanoparticles. And this is Tal Eshel-Green. This is her picture. And she was interested in drug delivery to the eyes. Now, I haven't mentioned that before, but mucoadhesive vehicles can be used either for local drug delivery to treat disease in the vicinity of where the vehicle delivers a drug, or a systemic drug delivery vehicle where you try to pass a drug to the bloodstream. In this case, she was interested in ocular diseases, and therefore she entrapped indomethacin, which is a drug, non-steroid, anti-inflammatory drug used in eye drops. But in usual eye drops, you put a drop, and 2 seconds later, the drug is gone. So we thought, why don't we take nanoparticles, or in this case, micelles, I will show it in a minute, and trap the drug inside them, and then use acrylated micelles to adhere to the mucosa of the eye. Now, the nano here is very important because we don't want anything covering our eye without being able to see. So we need very small particles that will not block our sight. So what Tal did was to prepare acrylated blocopolymer micelles. So this is called pluronic. I don't know if you heard about this, but pluronic is a tri-block copolymer used in the pharmaceutical industry. It's a PPO, 2 PPO blocked in the sides, and then, 2 PEG blocks in the sides, and then a central PPO block. And if you heat it up above body temperature, around 37, this is, there are many pluronics. This is pluronic F127, if you heard about this. This particular pluronic, above 37 degrees, the central block, which is PPO, becomes more hydrophobic, and then it creates a micelle. A micelle is like a tiny ball, nanometric ball, with a hydrophobic core and a hydrophilic corona. And the hydrophilic part outside has, in our case, acrylated PEG. Okay, so you take the pluronic and you do the chemistry, and you have acrylate end groups. And by that, you can attach the micelles to the surface. So I will start here with some evidence that after acrylation, we still have micelles, because it is not good enough to do the chemistry. Maybe you cannot form micelles. So this is small angle X-ray scattering, one of the methods we work with. And this is a quite complicated technique for those who do not work with this. So I will just say that you have the experimental evidence, and then you do some mathematical manipulations that help you to identify the shape of the structure that you are looking at. And all I want to show you that the shape of the graph is similar for the pluronic and the acrylated pluronic. Another thing I want to show you is that when you add mucin to the micelles, you can see that if you use the pluronic, the native polymer, you don't see many changes. But if you use the acrylated pluoronic, you see changes at low angles. This means that there is some kind of interaction between the mucin and the blockopolymers. We also verified sorry about that. We also verified that the micelles can release the drug at some rate. Sorry, I'm going the wrong way. And now we had to see that these micelles are indeed mucoadhesive, so we cannot pull anything here. So what we did is, again, our trick with the viscosity, the Hassan method. And here you see that the mixture of the micelles with mucin has higher viscosity than the components themselves. And we could also quantify the adhesion between the components by NMR. And with NMR, we can quantitatively follow the height of the peak or the area under the peak representing the acrylate groups, and by that see how many micelles attach to the mucosal layer. Okay, here you can see cryo-TM images showing that when you mix the acrylated micelles with mucin, you have large aggregates. This is since the micelles are pulling the mucin together and causing aggregation. However, when you do the same with the pluoronic, you see much, much larger aggregates. So what we think is, when you have the acrylated micelles, you have large aggregates caused by the interactions between the micelles and the mucin. This also exists due to hydrogen bonds between pluoronic micelles, but to a much lesser degree. Okay, so this is one type of nanoparticles, and this is another kind of nanoparticles. Chitosan nanoparticles, which are known to be used in the pharmaceutical studies and industry to deliver drugs through the mucosal layer, mainly since they are known to open junction zones. So this is Shaked Eliyahu, and she created acrylated chitosan nanoparticles, and the motivation was to allow transport of large molecules, macromolecule. What we wanted to do is to perform release of heparin, which is used against blood clotting. So what she did is to acrylate the chitosan nanoparticles and then compare it to the chitosan nanoparticles without acrylation. And to create the nanoparticles, she used physical cross-linking with a salt, with TPP. So this is not a covalent cross-linking, again, without any toxic materials. So she can create the nanoparticles, and I'm going to show you both the DLS with the particle size, about 130, 140 nanometers, something like this. And here you can see the cryo-TM image of the nanoparticles themselves. So they are not aggregated, and they can be encapsulated with the drug. Now, as I said, the challenge is a continuous challenge to see how to measure mucoadhesion. So now, with nanoparticles, again, it's even hard to do NMR, because if they aggregate, they will precipitate to the bottom of the test tube, and you are not able to test them. And viscosity is good, but again, with nanoparticle, one can claim that the particles themselves can change the viscosity. So what we did here is to use flow-through method. This is kind of a slide made of a plastic tube. You can see here a scheme. And again, we glue, with a synthetic glue, we glue a small piece of intestine tissue, and then we put the particles on it and wash it. It's kind of a homemade chromatography, because we collect fractions. And what we, for this assay, we used fluorescence nanoparticles. We conjugated fits to the chitosan to fluorescently label them, so we can measure the fluorescence, which is more accurate. You can see here just a microscope image of the surfaces demonstrating, but qualitatively, not quantitatively, demonstrating that the particles do stick to the surface and remain on the surface. But by analyzing the wash water, you can do the same quantitatively. So this is the percentage of particles residing on the surface, and this is for the acrylated nanoparticles and the non-acrylated nanoparticles. So for the acrylated nanoparticles, the part of particles remaining on the surface is twice larger by a factor of 2. So this is nice. Again, and this is again the retention, and this is another thing. I mentioned before the need to interpenetrate into the mucosal layer in order to have good adhesion. So you can see here that if you incubate the solution on the surface prior to washing, you can have much higher retention after incubation. So this is because the interpenetration takes some time. Okay, this is the last part of my talk. Still have some time. This is the last part. This is a project that was done in collaboration with Professor Avi Schroeder and Professor Imad Abul-Najj. Avi Schroeder is from my own department, chemical engineering, and Imad is a surgeon, a clinical surgeon. And what we wanted to do is to face the challenge of oral cancer. Oral cancer is a terrible disease. It's spreading in. It's much more common these days for many reasons that I will not go into. But the survival rate is very low, about 40–50%. And moreover, you cannot treat these patients with chemotherapy because for some reason, if you inject chemotherapy, it does not go to the tumor. This means that the only thing you can do to treat oral cancer patients is surgery. And this is a major surgery that you remove large parts of the oral cavity. This is terrible. I'm not showing pictures because this is really terrible. You do not want to see that. So what we wanted to do is to create a mucoadhesive patch that will be placed on the tumor and will reduce the size of the tumor and allow a smaller surgery. If we will be very lucky, maybe it will eliminate the need for surgery, but we will be happy even with a smaller surgery. So this is Yarden who worked on this project, and she started with, our initial thought was a paste, some kind of a paste that you smear on the tumor. And I will not go too much into the details, but we used a chemotherapy drug, doxorubicin, which we entrapped inside liposomes, and then the liposomes went into a mucoadhesive paste that was placed on the mucosal layer. And here you can see the retention of the paste and a cross-linked paste. We used alginate and several other alginates. So this is adhesion using flow-through, and this is a liposome released. And then we did some cell assays to show, now we don't want to see live cells, we want to kill them all. So dead cells are good result, good outcome. And in the test tube, it's not a big challenge, and we can demonstrate that the liposomes kill all the tumor cells. So this is not not very challenging. And these are liposome release. Oh, sorry. This is liposome release assays from different paste, different modified alginates and chitosan and all sorts of things. We could, bottom line, we could tune the release rate of the paste. But at this stage, I must say, we realized that using paste, wet paste, does not have I should say, a great future for commercialization or even application, because polysaccharides and even liposome undergo hydrolysis. So you cannot store them for very long times, and this is a challenge. This is one challenge. And the second challenge is that although using covalently associating polymers, we can obtain good adhesion to wet surfaces, underwater or wet environment, still the adhesion is much better if you use dry tablets. Therefore, we wanted to meet the next challenge, which was to transform this system into a dry one. And this is Layan who did the hard work, and eventually, after many, many tries, she was able to freeze dry the liposome. This is a cryo-SEM image. She was able to freeze dry the liposome while maintaining mostly the size and shape and without exploding, which is, as I said, it's a challenge. And after that, she created two types of drug delivery films or tablets. One was the layered tablets. You can see here the middle layer is liposomes with doxorubicin, which is pink. This is why it's painted pink here. So in the bottom and on the top, she placed some alginate as a mucoadhesive polymer, and in the middle, she placed the dried liposome. And this is a homogeneous tablet, which is just mixing everything together and compressing it into a dry film. And here you can see just photos and a scale of the tablets. And then first we did some release assays and also adhesion. So this is the drug release assay from the tablet. So it's over few hours, 7 to 8 hours. And then this is adhesion. And you can see I described these assays before, so I do not have to do that, but adhesion assays, and you can see the adhesion. And you can see that the adhesion is larger when the alginate percentage is higher, which is quite understandable because the liposomes do not have adhesion. Moreover, we can see that the higher alginate content improves the adhesion, and the homogeneous tablets and the layered tablets, have better adhesion. So you can see here many experiments with different alginate content, and you can see that the layered tablets with alginate on top and bottom adhere better. And finally, with the help of our collaborators, we were able to perform some in vivo studies in mice. So these mice were induced with oral cancer model. And then, if it's a layered tablet, you can just put it on the tongue of the mice. And if it's a homogeneous tablet, you don't have any other options, just to make a small incision and stick the tablets inside. We were thinking that with humans, that the other option is so bad, maybe people will be able to live even with, to comply with a small surgery with local anesthesia of inserting the tablets into the mouth. But we were very happy to see that this is not necessary because even the layered tablet worked very well. And what you can see here is that the size of the tumor was reduced by 1 order of magnitude. So the tumors were very much so smaller after treating with the tablets. So I will stop here, although I have many other stories, but it is getting long. I hope that I convinced you that we have been able to produce mucoadhesive vehicles that can be used in various ways. It's a generic process that can be used to acrylate any polymer. I have not shown many Malay-Mid modifications, but this works too. And of course, I cannot finish this talk without acknowledging all the people over the year that have done, I'm not doing anything, right? I'm just sitting in my office. These are the people who are doing the work, the PhDs, the graduate students and researcher, undergraduate students, some funding, of course, my collaborators. And this is my research group. This is our annual meeting in my backyard with the families. I'm proud to say that most of my PhD students are really females. And since in Israel we have a mandatory military service, both for boys and girls, most of them are older, so they have kids, you can see here. So these are mothers that were able to do nice research, I think. And this is my current research team, which is not that large, but nice. And thank you for your attention.
Professor Havazelet, thank you very much for your amazing presentation. Mucoadhesive has many applications, and of course, we are very interested in your research lines. We will keep in touch after to send you some ideas about some possible collaborations, and thanks a lot. Somebody has comments or questions?
Can you hear me? Yeah. So thank you very much for this very interesting talk, and especially the last results are very promising. I'm interested in drug delivery to the brain, so via intranasal to let's say to bypass the blood-brain barrier. Mucoadhesive can be also, well, how would you balance the adhesion of a particle when you need that this particle goes to a cell, for example, to a nerve? Can mucoadhesive be something that complicates this?
Yeah. There is a debate in the literature, you may know, about mucoadhesion under these circumstances, that you want a nanoparticle as a whole to transport the barrier. I have not shown these results with too many, but Shaked has done also cell assays with collaborators from Portugal, and she used cell sheets, and she measured the transport of the particles through the layer, and they do cross. Although they are mucoadhesive, they do cross the layer of the cells. So you may want to look into her publications. She has several, and the last one deals with this transport of, maybe not the last one. Anyway, look at it. So these particles go through, although they are mucoadhesive, because the mucoadhesion delays the transport, but does not prevent it.
Thank you.
More comments or questions?
Thank you for interesting lecture. Based on an experience in mucoadhesive polymers, what do you consider the most effective methodology for studying molecular interaction under physiological relevant conditions? Whether in vivo, in vitro, or in situ.
I'm sorry, I'm not sure I can understand the question. Can you please?
Yes. What do you consider the most effective methodology for studying molecular interaction?
Molecular interactions,
yes.
Okay. To study molecular interactions, I think that NMR is quite good. We have also used FTIR and ITC. But ITC, isothermal titration calorimetry, is quite tricky in these systems because the signal is very low. But sometimes you can use it. So without any, quite often we use NMR or FTIR to study the interactions.
Or questions?
Thank you very much for your great talk. I am curious about your first answer because, for example, if you have your preparations, about adhesiveness for your dosage to our administration through via intranasal, I don't know if in what dosage form do you think it would be the better way to administer for example, a nanoparticle, like in a gel, in a patch, or something in the nose? I don't know if you have something idea or knowledge about that.
If the nanoparticles are better than a hydrogel, this is
about the adhesiveness. With the interaction of your formulation with the mucin of the mucus and
yeah, I think that the best adhesiveness is obtained with dry samples. This is what we see. So if you can put a patch, you will have better adhesion. However, in the nose, it's not very convenient to put dry patch.
Yeah.
And in the eye, it's impossible. So if you're looking in the oral cavity or whatever, it's best to use dry systems. But sometimes you need to settle for the wet system.
Okay.
To compromise.
Yeah.
Yes.
Okay. Thank you.
Hi, nice to meet you. I have a question. What's the principal objective of the research about the better conditions of the vehicle to be more adhesive to the mucins? And what are the pharmacological components that we can use in this sense? What's the objective?
Okay. The objective here is that if you want the drug to be transported from your vehicle to the bloodstream or to the locally in the tissue, you need enough time, because drug transport is by diffusion, and diffusion is a very slow process. So let's take, for example, the eye drops. If you put an eye drop, it will wash away by the tears, and after seconds, it will be washed away, and not much of the drug will have enough time to cross the mucosa layer and the epithelial cell and everything to go in. So if you have adhesiveness, you have extended time of the vehicle on the tissue, and then you will have more time for diffusion. So that's the purpose. As for drugs, it's a very generic system. You can put anything you want. So,
okay, it's to get a better absorption of the pharmacological principle. Yes.
Absorption of, yes.
Okay. Okay. Thank you.
It simply takes time.
What do you think is the next step for this project? Personalized medicine or industrial levels?
What is the next step for industry? Okay, money. It's not a very polite. I was intuitive. It's not a very polite answer, but this is from my experience. We wrote a patent, and now we are looking for an industrial partner to commercialize it, especially because eye drops are nice, but the chemistry is chemistry, so it takes time and money. And frankly, I have hard time to believe that a company will invest money in commercializing better eye drops. So I don't know if this will happen. But for oral cancer, the damage is so huge, and also it costs money to the state, right, to treat these people. So we are looking for a company to commercialize it. It's not very easy because it's an early stage. Usually when you have some money, you can do experiments in larger animals, and then it's easier to sell it. This is my experience for my former my former project. But you need money to push it further.
Thank you.
I have a question. The acrylated chitosan could be useful for adhesion in the small intestine?
Is it, sorry?
The acrylated chitosan,
Yes.
chitosan could be useful for adhesion for the small intestine?
For the small intestine. I think so. Yes, I think so. The challenge with the GI tract in general is that you don't want it to react on the way. So it could be useful to use an enteric coating on top to open only in the small intestine. But I think so, yes. I think so.
Question or last comment?
Hi, I'm just curious about the mouse model. Is it a cell line of oral cancer, or are they transgenic mice that develop the cancer?
Yeah, it's a cancer. It's cancer cells, and unfortunately, I'm not fully educated to answer specific questions about the tumor model, because this was done by my collaborator, who is much expert in in animal studies.
Okay,
So
thank you.
I'm here from the polymer point of view.
Thank you very much for your presentation. We have a special souvenir for you. I hope you will enjoy it.
you very
Very
much.
welcome to Mexico City, and very welcome to the School of Chemistry. Thank you for all the comments and questions, and I hope to see you again soon.
Hopefully, yes.
Thank you.